If a biceps tendon's torn, most doctors, including myself, want to fix it within 3 weeks, and we'll move heaven and earth to make that happen. Here's a common story I see. A dad is lifting his child, and as he's lifting up, things go down, and there's a pop in the elbow, and the bicep looks much different than it did 5 seconds ago. And that's what we call a distal biceps rupture. And distal biceps ruptures are dramatic and scary, but they do really well if treated properly, and I enjoy treating them properly. There's techniques that have come out in the last 10 to 15 years that have dramatically improved the treatment of distal biceps ruptures and allow you to not only have a proper healing of your biceps rupture, but limits the downtime. And it's a condition I enjoy treating. The distal biceps is the thick tendon you can feel extending from the top of the biceps into the forearm. It attaches deep into the radius bone. There's actually 2 tendons that fuse into one. So when people feel a tear, they literally feel a tear and a pop. And often they'll feel one pop and things will be sort of okay, and then they'll lift again and feel that second pop. And that's a pretty sure sign I see of a distal biceps rupture. Now that biceps isn't the only muscle where you think your bicep is. There's another muscle underneath that allows you to still bend your elbow, even with a distal biceps rupture, so it can be somewhat confusing. The real diagnostic feature of a distal biceps rupture is the twisting of your arm, like you're opening a door. There's only one big muscle doing that, and that's your biceps muscle. And so when people tear their biceps and feel that rip, they'll still be able to bend, but trying to open a door is excruciating, and that, for me, is a very strong sign of a biceps rupture. Again, age is important. 40 to 60-year-olds are very commonly tearing their distal biceps tendon, and if there's any question about whether it's a tear or not, we may need to get further imaging, like an MRI, to look in there. But many distal biceps ruptures, maybe 75%, need no imaging because they're quite dramatic. Think of a lampshade rolling up on itself up into the top of the shoulder. That's what a biceps rupture is. And literally, surgery is to unwind that and reattach it back into the bone. And turns out, lucky enough, we can fix those and you can have a really good arm for the rest of your life. Well, the typical patient that tears their bicep, it's fairly dramatic, and often they'll go to the emergency room quickly to figure out what's going on. Now, patients often will have had a little bit of pain leading up to the incident and may often not go into the emergency room right away. And in that case, you can just come see me right away. And that can be the day of the injury, the day after, or within the week of the injury is still plenty of time. Some patients who have a wearing out tendon don't always have the more acute story, and they'll find that their bicep is just hurting more and more right deep in that front of the elbow, especially with biceps curls or other type of lifting things, especially fast lifting and quick lifting. In that case, we may work it up with an MRI and see what exactly is going on in there. And often there's enough tearing that we still need to fix the biceps tendon, or sometimes we can rehabilitate it. But there's acute injuries where it rips off, and then there's tendinitis that turns into tendon tears that's a little less dramatic, but a lot more frustrating. We're always happy to see those at any stage in the process and figure out where you're at and move things along quickly. If a biceps tendon's torn, most doctors, including myself, want to fix it within 3 weeks, and we'll move heaven and earth to make that happen. I think you'll find the clinic visit for your bicep injury is pretty straightforward. If it's torn, it's pretty obvious to everyone, and we'll proceed from there. If there's question, you'll come in and we'll do a proper exam and sort out whether an MRI would help us with our decision making, whether therapy is something we want to consider, or whether we're pretty sure that without further imaging we can just continue on with surgery. Now, surgery itself is a day surgery. You go in and come home the same day. You go home usually in a sling and a splint, and you rest for a week after surgery. And then usually if your wound's healing well, we'll start moving your arm pretty normally right away. Now that attachment isn't ready for anything more than about 5 pounds, but you can move it a lot and work at pretty high level motion activities, but not high level strength activities for the first 6 to 8 weeks. Many patients don't even need therapy with a biceps injury. They can do much of it on their own, but some patients find it valuable to work with a therapist to strengthen. By 3 months, that attachment's strong enough that then you can lift in an unrestricted way. Prior to 3 months, we'll have a gradual process to properly strengthen that, properly get you back to full activity without stressing our repair.